Millions of people consume raw garlic every morning, convinced that it is the best natural remedy in the world. But what if that same habit you believe is protecting you was silently interfering with your medications, altering your blood, and putting your life at risk? What you are about to discover will forever change the way you see this small white bulb. For thousands of years, garlic has been considered one of the most powerful remedies in nature. Entire civilizations used it as medicine, from ancient Egypt to classical Greece. Hippocrates himself, considered the father of modern medicine, prescribed it to treat respiratory infections, intestinal parasites, and extreme fatigue. Today, millions of people around the world follow that same ancestral advice. Every morning, on an empty stomach, they chew a clove of raw garlic, convinced they are doing something extraordinary for their health. But there is something that almost nobody has told them. Raw garlic contains an extraordinary compound called allicin. This powerful element is released only when garlic is cut, crushed, or chewed. It is responsible for that characteristic smell and at the same time for most of its medicinal properties. Allicin has anti-inflammatory, antibacterial, and antioxidant effects that have been scientifically proven. However, there is a critical detail that most people do not know. Allicin is extremely unstable. It disappears completely when garlic is cooked at temperatures above 60 degrees Celsius. That is why raw garlic is considered the most potent form, and also the most dangerous for certain groups of people. Today, the advice to eat raw garlic every day has gone viral on social media. Videos with millions of views recommend chewing a garlic clove every morning to lower cholesterol, control blood pressure, strengthen the immune system, and even prevent cancer. It sounds perfect. It sounds natural. It sounds safe. But doctors and pharmacologists who study interactions between foods and medications have a very serious warning that most of those videos completely ignore. A warning that could make the difference between healing and seriously harming yourself. Before continuing, you need to understand something fundamental. There are two completely different types of garlic consumption. The first is culinary use, adding cooked or fresh garlic to your meals in normal amounts. That use, in general, does not represent a significant risk for most people. The second type is medicinal use, consuming one or more cloves of raw garlic daily with the goal of treating a health condition or taking garlic supplements in capsules, garlic oil, or garlic powder. This second type is exactly where the real problems begin for millions of people. The data is alarming. Millions of people around the world take medications daily to control chronic diseases such as hypertension, diabetes, blood clotting disorders, or viral infections. At the same time, many of those same people follow internet advice and add raw garlic to their daily routine without consulting their doctor. What they do not know is that raw garlic, especially in medicinal doses, has the chemical ability to modify how the body processes numerous medications, and that silent process can have potentially fatal consequences if it is not recognized in time. Throughout this documentary, we are going to explore in scientific depth exactly what happens to the body when raw garlic is combined with different types of medications. You will discover which groups of people are at greatest risk, which medications are incompatible with garlic, how garlic acts at a molecular level in your blood and in your enzyme system, and what science says about a safe dose. This information has been verified with high-level medical sources such as the Merck Manual, Botanical Online, and specialized pharmacological studies. Pay close attention because this could save your life. To understand the real danger, we first need to know the complete history of garlic as medicine. Garlic belongs to the allium family, and its scientific name is Allium sativum. It arrived in Mexico and Latin America brought by Spanish conquistadors, but its medicinal use already existed in Asia and the Mediterranean for more than 5,000 years. Modern research has confirmed that garlic effectively has anti-inflammatory properties, slightly reduces blood pressure, and can lower LDL cholesterol. These are real benefits. The problem begins when it is consumed in amounts that go beyond dietary use and enter medicinal territory.
One of the most surprising facts about garlic is that its active compound, allicin, does not exist inside uncut garlic. When the bulb is intact, there are two separate components, allin and an enzyme called allinase. Only when garlic is physically destroyed by cutting or chewing it do these two substances combine and produce allicin. This process is fascinating from a biochemical point of view, but it also means that the raw and freshly crushed form of garlic is the one that contains the highest concentration of active compounds, and those active compounds are precisely the ones that interact with medications. For decades, medical professionals observed something curious. Patients who were taking anticoagulants and at the same time consuming large amounts of raw garlic experienced inexplicable episodes of excessive bleeding, gums that bled for no apparent reason, wounds that took too long to close, internal hemorrhages in more serious cases. Researchers began to study this relationship and discovered that garlic has natural antiplatelet aggregation properties. That is, it interferes with the blood's ability to form clots. When this property is combined with anticoagulant medications, the effect multiplies dangerously, turning a simple wound into bleeding that is difficult to control. But garlic does not only affect coagulation. Scientists identified a much broader and more concerning mechanism. Garlic has the ability to block a group of liver enzymes known as cytochrome P450, specifically the CYP3A4 variant. This enzyme system is absolutely fundamental to the human body because it is responsible for metabolizing, that is, processing and eliminating, the vast majority of the medications we consume. When garlic blocks these enzymes, medications are not processed correctly. They accumulate in the body at higher concentrations than intended, or, in other cases, their effectiveness almost completely disappears. This finding about cytochrome P450 was revealing for modern pharmacology. Researchers understood that garlic was not simply a food with secondary medicinal properties. It was an active substance with the real power to alter pharmacokinetics, meaning the behavior of medications inside the body. This places it in the same category of foods and substances that require pharmacological caution, alongside grapefruit, St. John's wort, and certain herbal supplements. The difference is that garlic has a completely positive and natural public image, which causes millions of people to consume it without any type of medical precaution. What makes this problem even more complex is that the effects of garlic on medications are not always the same. Depending on the type of medication and the mechanism of action of that drug, garlic can do two opposite things. In some cases, it potentiates the effect of the medication, bringing it to toxic levels inside the body. In other cases, it reduces its effectiveness to the point of making it completely useless. Both scenarios are dangerous. A medication that is too potent can cause serious adverse effects. A medication with no effect leaves the patient without the protection they need to survive their illness. This duality makes it especially treacherous.
Let us now analyze the most critical interactions one by one, starting with the most dangerous of all, raw garlic and anticoagulant medications. Anticoagulants are medications that millions of people take daily to prevent blood clots, heart attacks, and strokes. Among the most common are warfarin, Sintrom, clopidogrel, heparin, and aspirin in therapeutic doses. All of these medications already function to reduce blood clotting. When raw garlic is added to this equation, its antiplatelet aggregation compounds add their effect to that of the medication, pushing clotting to extremely dangerous levels and increasing the real risk of internal hemorrhage. The second critical interaction involves diabetics who take medications to control their glucose. Raw garlic has a scientifically proven property. It reduces blood sugar levels. This may seem beneficial for a diabetic, but if that person is already taking metformin, insulin, or other hypoglycemic agents, the combined effect can be devastating. Glucose levels can fall below safe thresholds, producing severe hypoglycemia. Symptoms include extreme dizziness, mental confusion, loss of consciousness, and even seizures. In cases not attended to in time, severe hypoglycemia can cause permanent brain damage or death. The third interaction affects people who take medications for HIV. Specifically, raw garlic can significantly reduce the concentration of sequinavir, an antiretroviral protease inhibitor, in the blood. Clinical studies have shown that garlic consumption can reduce sequinavir levels in the body by up to 50%. This means that the medication that should be actively fighting the virus stops working at half its capacity. For a person with HIV, this is not a minor side effect. It is a direct threat to the control of their disease and to the functioning of their entire immune system. There is also an interaction that affects those who take immunosuppressive medications, especially tacrolimus. This drug is vital for people who have received an organ transplant, as it prevents the body from rejecting the new organ. Garlic, by interfering with cytochrome P450 enzymes, can raise tacrolimus concentrations in the blood to toxic levels. Studies conducted in animals have shown that this combination can cause severe liver damage. For a transplant patient whose life depends entirely on that medication working at precise doses, this interaction can be absolutely fatal and irreversible. Blood pressure medications also appear on this list of dangerous interactions. Raw garlic has natural hypotensive properties. It reduces blood pressure. When someone who is already taking medications such as verapamil or diltiazem to control their blood pressure consumes raw garlic daily, the combined effect can bring blood pressure to dangerously low levels. This condition is called severe hypotension. Symptoms include intense dizziness, blurred vision, sudden fainting, and in extreme cases, cardiovascular collapse. Elderly people who live alone are especially vulnerable because a sudden faint can produce falls with very serious consequences. Finally, there is an interaction that many women are completely unaware of. Raw garlic consumed in medicinal doses can interfere with the effectiveness of birth control pills. The mechanism is the same. The blockage of cytochrome P450 alters the metabolism of the synthetic hormones contained in oral contraceptives. If those hormones are not processed correctly, their concentration in the blood changes and contraceptive protection can become compromised. It is important to clarify that this does not occur with garlic used normally in cooking, but specifically when raw garlic is taken daily or garlic supplements are consumed habitually and continuously. With all of this accumulated evidence, an urgent question arises. What does science say about who can safely consume raw garlic and in what amount? Researchers have worked to establish clear parameters. According to modern pharmacological analysis, the dose of raw garlic considered safe for a healthy adult without medication is approximately 4 grams daily. That is equivalent to 1 or 2 cloves of fresh garlic. This amount, in a person without special medical conditions, generally does not generate significant interactions. The real problem begins when these amounts are exceeded or when the consumer has an underlying health condition they do not consider relevant. Researchers have also precisely identified the highest risk groups. The first group includes all people who take anticoagulants, such as warfarin, Sintrom, therapeutic aspirin, or clopidogrel. The second group is diabetics under pharmacological treatment. The third group is HIV patients taking protease inhibitors. The fourth group is organ transplant recipients taking tacrolimus or cyclosporin. The fifth group is people with low blood pressure or those taking antihypertensives. The sixth group is women who depend on oral contraceptives as their only method of protection. All of them must consult their doctor before incorporating medicinal garlic. A study published in the Merck Manual specifically documented the interaction between garlic and saquinavir, demonstrating reductions of up to 50% in the plasma concentration of the drug. Parallel research conducted by clinical pharmacology teams confirmed that garlic compounds act as inhibitors of the CYP3A4 enzyme system in the liver. These findings led many European and North American health systems to include specific warnings about garlic consumption in the package inserts of certain medications. The evidence already exists. The problem is that this information does not reach patients with the clarity and urgency it should have. Researchers have also studied in depth the relationship between garlic and digestive system disorders. People with irritable bowel syndrome, or SIBO, which is small intestinal bacterial overgrowth, represent a particularly complicated case. Garlic is rich in fructans, a type of fermentable carbohydrate that directly activates and feeds the problematic bacteria in the small intestine. Furthermore, in the hydrogen sulfide variant of SIBO, the sulfur compounds in garlic directly worsen the excessive production of that toxic gas, intensifying symptoms such as severe bloating, chronic abdominal pain, and persistent diarrhea that completely weaken the patient's quality of life. Scientific research has also analyzed the relationship between garlic and the thyroid. Garlic stimulates the general metabolism of the body. In people with hypothyroidism, this could, in theory, be beneficial. However, for people with hyperthyroidism, a condition where the thyroid already produces excess hormones, the habitual consumption of raw garlic can intensify symptoms significantly. The additional metabolic acceleration can cause greater involuntary weight loss, tachycardia, increased anxiety, severe insomnia, and extreme irritability. People undergoing thyroid treatment with specific medication must obligatorily consult their endocrinologist before consuming garlic for medicinal purposes. One of the most important recent studies comes from a 2023 meta-analysis review documented in the Merck Manual, which confirmed that garlic can have positive effects on HDL cholesterol and arterial stiffness. However, the same report clearly warns that the combination of garlic with statins, the most prescribed medications in the world for controlling cholesterol, such as lovastatin, simvastatin, and atorvastatin, can potentiate their effect to levels that cause myopathy. Myopathy is a condition of severe muscle damage that in its most serious forms can affect the cardiac muscle and put the patient's life at risk. After all of this information, it is crucial that you do not reach the wrong conclusion. The goal of this documentary is not to demonize garlic. Garlic is an extraordinary food with scientifically proven benefits for human health. The key is to understand a fundamental distinction that most people completely ignore. Garlic used as a condiment, cooked or fresh in small amounts within your meals, does not represent a significant risk for most people. The problem arises exclusively when garlic is used with medicinal intent, in high doses, in raw form daily, especially when an underlying health condition or an active pharmacological treatment exists. For those who want to take advantage of the benefits of garlic without the risks, experts in nutrition and pharmacology offer clear and evidence-based recommendations. First, if you take medications of any kind, always consult your doctor before incorporating raw garlic into your daily routine. Second, do not cook garlic above 60 degrees Celsius if you want to benefit from its properties, but remember that cooked garlic does not generate the dangerous interactions of raw garlic. Third, if you decide to consume raw garlic, let the crushed garlic rest for at least 10 minutes so that allicin activates completely. Fourth, avoid garlic supplements without medical supervision if you have any diagnosed chronic condition. If you are going to undergo surgery, whether major or minor, the universal medical recommendation is to stop consuming raw garlic and garlic supplements at least 2 weeks before the procedure. This includes capsules, garlic oil, garlic powder, and raw garlic cloves consumed daily. The reason is direct. The anticoagulant properties of garlic can increase bleeding during surgery, hinder the healing of postoperative wounds, and in some cases seriously complicate recovery. This advice comes from standard surgical protocols backed by the American Society of Anesthesiologists and is documented in multiple internationally recognized medical reference guides. After all of this information, it is crucial that you do not reach the wrong conclusion. The goal of this documentary is not to demonize garlic. Garlic is an extraordinary food with scientifically proven benefits for human health. The key is to understand a fundamental distinction that most people completely ignore. Garlic used as a condiment, cooked or fresh in small amounts within your meals, does not represent a significant risk for most people. The problem arises exclusively when garlic is used with medicinal intent, in high doses, in raw form daily, especially when an underlying health condition or an active pharmacological treatment exists. For those who want to take advantage of the benefits of garlic without the risks, experts in nutrition and pharmacology offer clear and evidence-based recommendations. First, if you take medications of any kind, always consult your doctor before incorporating raw garlic into your daily routine. Second, do not cook garlic above 60 degrees Celsius if you want to benefit from its properties, but remember that cooked garlic does not generate the dangerous interactions of raw garlic. Third, if you decide to consume raw garlic, let the crushed garlic rest for at least 10 minutes so that allicin activates completely. Fourth, avoid garlic supplements without medical supervision if you have any diagnosed chronic condition. If you are going to undergo surgery, whether major or minor, the universal medical recommendation is to stop consuming raw garlic and garlic supplements at least 2 weeks before the procedure. This includes capsules, garlic oil, garlic powder, and raw garlic cloves consumed daily. The reason is direct. The anticoagulant properties of garlic can increase bleeding during surgery, hinder the healing of postoperative wounds, and in some cases seriously complicate recovery. This advice comes from standard surgical protocols backed by the American Society of Anesthesiologists and is documented in multiple internationally recognized medical reference guides.
For people with digestive diseases such as irritable bowel syndrome or SIBO, the solution does not involve completely eliminating the flavor of garlic from their culinary life. Researchers have discovered a practical and effective alternative: garlic-infused oil. When garlic is macerated in oil and then the solid is removed, the fructans and sulfur compounds do not transfer to the oil. The oil retains the aroma and part of the flavor of garlic without the problematic compounds. This technique allows people with digestive sensitivity to enjoy the flavor of garlic in their meals without triggering the gastrointestinal symptoms that raw or whole-cooked garlic would normally cause them. The future of research on garlic and its pharmacological interactions points toward the development of forms of garlic that preserve cardiovascular and immunological benefits without activating the enzymatic interference mechanisms. Aged garlic extract, known as AGE, has shown promising results in preliminary studies. This extract is produced by allowing garlic to mature for at least 20 months, transforming the unstable compounds into more stable and less reactive forms. Research suggests that AGE can offer benefits for blood pressure and cholesterol with a considerably safer pharmacological interaction profile than conventional raw garlic. What you have learned today represents medical information that can literally protect your life or the life of someone you love. Raw garlic consumed daily is not a universal and harmless remedy. It is a powerful bioactive substance with real pharmacological effects that interacts with dozens of medications in a potentially dangerous way. Nature is not always synonymous with safety. Before following any health advice you find on the internet, consult your doctor. That 5-minute conversation could prevent a serious medical emergency. Share this documentary with whoever needs to hear this information, because the best medicine always begins with correct and scientifically verified knowledge.